Hello and welcome to the Anxiety Disorders Association of British Columbia website and to this special section on childhood anxiety. I'm Dr. Michael Catchpole. My guest is Dr. Jane Garland. Dr. Garland is a professor of psychiatry at the University of British Columbia and is clinical director of the Mood and Anxiety Disorder Clinic at the British Columbia Children's Hospital. Dr. Garland, thanks so much for being here.
Thanks for having me, Dr. Catchpole.
Dr. Garland, all children are anxious, as we know, as are all grown-ups, but could you talk a bit about how anxiety in children can reach clinical significance?
Many of the anxieties that children have are normal anxieties, such as being away from their parents. The problem is when the anxiety becomes too intense, too prolonged, and gets in the way of their functioning, like going to school, having friends, or even getting to bed at night.
Fair enough. Can we talk a bit about the signs and symptoms of childhood anxiety problems?
The symptoms really fall into three categories. Anxiety shows up in the body, it shows up in the mind and the feelings, and it also shows up in the behaviors, which is often a challenge for parents.
Let's talk about the body symptoms first then. Could you elaborate on that?
Anxious children will have stomach aches, headaches, muscle tension, their heart will race, or it'll be hard to get their breath. They don't feel good.
And how about psychologically?
Anxious children worry. They often have a lot of negative thoughts, they imagine the worst, and they often cry easily and are more emotionally fragile.
And the third category you mentioned was behavioral, and you kind of hinted that these are the real tough ones. Could you elaborate on that for us as well?
Well, it's a challenge because if a child is anxious, they don't want to go to school, and if you try to push them to do that, they'll often have a pretty big tantrum. And the same with going to bed if they're anxious about that. So parents deal with a lot of tantrums and irritability, and especially avoidance.
Okay, let's talk about some home management strategies then to try to address some of this. Can you give us one example of a good home management strategy?
A global approach is really to listen to these children and recognize and understand that their anxieties are real to them, but we need to encourage them through them. The second big thing is to recognize that people who are anxious don't do well with change or uncertainty. So that means that having a regular routine helps a lot.
That's very interesting because in this modern world with parents working different hours and shifts and all that, it must be very difficult for parents to structure their child's time compared to perhaps how it was 50 years ago.
It is a challenge, but it really pays off. If children have a regular bedtime, homework time, meal time is organized, actually parents often feel calmer too.
Well, I would think if the child's in bed and that's it at 8 o'clock, for example, then mom and dad can actually have some quality time together, which must be a plus. Mm-hmm. Other home management strategies?
One of the big challenges is to make sure that anxious children have real problems dealt with. For example, if they do have a learning disability or there is a bully at school, parents need to be advocates to make sure those problems are dealt with.
All right. And I want to pull you back to the remark you made about avoidance. Can you elaborate on this issue of avoidance?
Avoidance is instinctive when we're anxious. All of us do it. But what that means for children is they're not really accomplishing their developmental tasks. So parents need to coach them to have brave behavior and face their fears.
This is interesting because, of course, parents are usually very protective and I guess they kind of unintentionally enable a child to not develop certain skills?
That's right, but there are a lot of things parents can do in the other direction. For example, if a child is too shy, you could encourage them to ask for their own ice cream cone at the store. So there's a reward for asking, and through practicing, they'll build confidence.
And what about, say, with a phobia?
Well, phobias, as you know, are excessive fear of something which often most people are a little bit afraid of, such as heights or getting blood tests. And again, the approach there is to desensitize them. In other words, get them to practice facing that phobia in small steps so that they build their confidence.
All right. Dr. Garland, thank you so much. My guest has been Dr. Jane Garland from the University of British Columbia and from BC Children's Hospital.